for two years, and and I've been a social worker for about 25 years. So this is a great honor to be here and talk to you guys. Um, so in prepping for this, we talked about a few things, and then one of the questions that Erin came up with or presented to me was, when would I need a social worker? So the first thing to understand is there are different kinds of social workers. There are social workers who are medical social workers, which I am, because I work in a primarily or only medical kind of environment. So I work here at the clinic. I used to work in the hospital. And the way that you connect with a medical social worker is usually like your doctor would refer you, or you probably would meet somebody if you were admitted to the hospital. They're often part of the discharge planning team, so they would help with setting things up for when it's time for you to discharge from the hospital. Um, and I'm also as an overlap, I'm a licensed clinical social worker, as you mentioned. And so what that means is I've done um, an, an an internship for a couple of years, and I've taken exams that allow me to privately practice. So I've done psychotherapy with people, and that was what I was doing before I came to Hoag. And I was trained in psychoanalysis. So I'm a little bit of an overlap kind of a person. And like I said, there are different kinds of social workers, but for the purposes today, I think one of the other ones that might be useful to know about is a county social worker. Has anybody ever had to talk to somebody at the county for resources that might be available through the state or through the county? No? Okay. Um, I think a lot of times there are things that are available and people don't realize that they're available. And the county social workers can help with that application of putting it through, like for Medi-Cal, which is California's version of Medicaid, um, and or transportation. There are transportation options available for people who have Parkinson's or other um, disabilities. There's also in-home supportive services, which is a program that they have if you need a caregiver at home. Um, and sometimes some of our patients who require like a family member to help them with things, um, that family member can get paid through the county for taking care of the person. They become their caregiver aide. Um, there's also resources for housing for seniors. There's a huge list of affordable apartments and housing that's available out there. And there's something called the Orange County Case Management, which is a really cool thing. I called them the other day, and their purpose is to make sure that people who are at risk for not being able to stay independent or in their home, they have resources for those people to try and keep them at home with support so that they don't have to be put into a residential kind of situation. And then, of course, there's always CalFresh, which is the social workers at the county can help, like with um, food and nutrition options, food stamps, things like that. So those are just some of the things that the county social workers do. Um, and so let's go back to like the medical social worker. Who does a medical social worker work for? So the short answer is that the medical social worker works to optimize the well-being of the patient. Um, but we recognize that part of the well-being of the patient is taking care of the important people who are taking care of the patient. So it's not just about how the patient is doing. And we do understand that when a person gets a diagnosis, the whole family gets the diagnosis because there's a lot of changes that happen from that day forward. So we're here to take care of that so that that team can take care of the patient. And when I say team, it's interchangeable with your important people. And it's the people who care for the patient. So family, spouses, partners, friends, even caregivers, like if you hired a caregiver, um, that would be part of your team of important people. Um, so when we take care of that, we do that through a variety of different ways, and I'll get into that. One of the important ways is through support groups. So the whole purpose of our program here is that we often say once you meet one person with Parkinson's, you've only met one person with Parkinson's. Everybody's journey is different, and we try to be adaptable to that so that um, we're not putting somebody into um, certain box or expectations or stages that uh, you would go, okay, well now because of this, you are going to need this. You know, everybody's different. So we've come up with a variety of support groups. So we've got Tai Chi for Parkinson's. Um, we've got 2 Parkinson's support groups per month. Um, and we are doing something called Living with Intention, which is our brain health support group. And that is based on the 6 pillars of actually Dr. Bixby was the person who connected me to the 6 pillars and said, can we do a support group? And and so that's what we're doing. We work through a workbook and focus on the things we have that are like good sleep, um, reduce stress. Trying to think of what they are. Uh, Eating, exercise, all of the things that help improve brain health, reduce inflammation, reduce stress, so that you can optimize how you're doing if you are a person with Parkinson's or any other type of brain injury. We've got people in our group that are also have had strokes or traumatic brain injuries, things like that. Um, and then back to our important team, we do something called the Just Care Partners Group, which is a group of people, and it doesn't include patients. It's just for the partners that allow us to provide a space for the partners who are um, taking care of the patients and might have stress or need resources or things that we're here for. And I should say all of these are free events. My services are free, and it's because Hoag recognizes that this is something that really impacts the whole family. It's multi-system kind of impact that we want to ameliorate and try to help with and find solutions for. So we're here to help problem solve, and often even after all this time of doing this, there are new things that come up all the time. And so I always say, if you don't know who to ask me. And if I don't know the answer, I will find you the person that can help you with that, and we'll find the answer together. So, and in addition to that, we also do educational events. So those are, we're right in the middle of some changes here at Hoag. I don't know if everybody is aware of that. Um, we've got Dr. Hermanowitz has just joined us from UCI. He's a movement disorders specialist, and he's pretty wonderful. We're super lucky that we got him to come and join our team. And we've also got Dr. Bixby is in our office a couple days a week, but sometimes she's down in Aliso Viejo, which is probably where most of you are seeing her. Um, we've got Dr. Thakar, who is like the busiest working movement disorders person in Orange County. He's got 4 different sites, and he's got a number of um, physician assistants who also see his patients. And then Dr. Sarimi is also with us. Um, and he works out of the Huntington Beach office. And then we have a new person coming, and I don't know if I'm allowed to tell you who they are, but when that announcement comes through, I will definitely make sure that you guys hear about it. She'll be here May 1st. So that'll be another feather in our cap. We're trying to grow our program, and we're trying to make our program be an under one roof kind of situation. We're currently building down on the lower campus so that we have resources for our Parkinson's patients where they would come in. You would be able to see Belinda, our nurse navigator. You could see your doctor. You can see me. There would also be physical therapy and a variety of other resources. I'm blanking on all of the things that we're going to be. It's going to be a pretty big um, brain health kind of environment so that all of the different disciplines will be all together. So that's exciting. But back to what I was saying about the educational events, since we're currently bringing on new doctors, we're working on the educational events that we've got coming up. And in addition to that, we're working on a symposium that will be happening in October, I believe it is. Um, so lots of new and exciting things to build our program. Um, anyway, that's part of how we're trying to help the patient and the team. And then let me see here. One of the other things that Erin asked me to talk about.
Actually, Joey, before you bridge into the next one, can I ask you a
Yes.
few questions that have come up in the chat?
Oh yeah, shoot. Yeah, go ahead.
Oh, sure. Okay, so Marcia Kelly said, where will that facility be?
The new
Uh,
facility?
I believe that's what she was referring to, what you just said.
Yeah, it's going to be on the lower campus. So are you familiar with Hogue in Newport Beach?
She says
Okay.
no.
Okay. Where are you, Marcia? She writing? Let me get the chat going up here.
Let's see, Marcia, I'll ask you to unmute and then you can just press
There we
the
are.
button. There you
There
go.
you go.
I
Yay.
had a different screen. We are just moving here from Colorado to San Juan Capistrano. So
Oh,
we
okay.
are, um, we have my husband was diagnosed in Denver at the University of Colorado Medical Center.
Mm-hmm.
And so we will be looking for a movement disorder specialist here. And so I'm wondering, I'm not familiar with Hogue at all, and I'm not familiar with where your facilities are or where you can be reached, Joey, but would appreciate just a little bit of information, although I realize that everybody else probably already knows this. So maybe it would be appropriate for me to ask at another time.
No, that's okay, because it reminds me that I'm looking for a phone number here for you. So we're going to be, Hoag's is expanding to the San Clemente area. And for that satellite office, Dr. Hermanowitz will be covering. And so I can give you, oh goodness, where are you, Dr. Hermanowitz? I can give you his phone number. Um, there you go.
Perfect.
And I don't know exactly when they're going to be open, so I would suggest that maybe it would be worth a drive from, you said you would be in San Juan?
Yes.
Okay, that's not that far from us, just depending on traffic. And as all the California people smile.
Yeah, I was going
Um,
to say easy for you to say.
yeah,
There's so much traffic, but that's all
yeah,
right. We can manage.
yeah. I mean, technically it's just a shot down the freeway, but just don't do it during going to work hours or coming back from work hours. Yeah, so Dr. Hermanowitz has agreed that he would be covering sometime in our new satellite office. So until that is built in San Clemente, you might want to come to Newport Beach to get established with him. And Luis, yes, Dr. Thakar is taking new patients, but I think it's a ways out for booking with him, a couple months out. And I don't know if you've had, or if any of you guys have had any interactions with his physician assistants. They're super sharp and amazing, and it would be worth your time to even meet with one of them too. So,
Okay.
Yeah.
Yeah, like I mentioned, I just moved down here back from Florida. So January, so my new insurance here takes place on May 1st. So I need to find a primary and I need to find a movement disorder specialist. So I was
Oh,
recommended by
okay.
the people at YOPD. They all spoke very highly of Dr. Thakar. That's why first person I mentioned. But if the other doctors are just as good, then I'm open,
So you don't have to tell me now, but if you want, you could get a hold of me at this info, and I can find out what insurance you're going to have, and then I can tell you who, if he takes that, or if one of the other movement people takes that, and then what area will you be in?
I'm living in Fullerton right now.
Oh, okay. All right. Yeah. So he's out in Orange, so that would probably be the closest one of the offices that he goes to for you.
Okay.
Yeah.
Okay. Yeah, if
Hmm.
you don't mind, I'll reach out to you afterwards, Joey.
Yes, absolutely.
All right, thank you.
And if you guys don't mind, if you want to share your emails, I will put you on the email list, because I do a lot of emailing, and I do a calendar every month of the different support groups and things that are available. And if you could have seen my PowerPoint, which was really beautiful, by the way, it would you would see that you do not have to be a Hoag patient to use the Hoag support groups. It's open to anybody in the community. Okay, thank you, Luis.
Thank you.
Got it.
Perfect.
Okay.
And Joey, I'll make sure to follow up with you afterwards that you've gotten everybody on the list, just because
Oh,
this is being recorded, and so that I will get that for you as well. And
okay,
just so
sounds good.
everybody knows, I always put Joey's calendar that she sends me on the Parkinson's Orange County calendar. So there are a million ways to get that information, and those resources are available to you for free.
Yes, and I do have to say, one caveat is that we do fill up kind of fast. But when we fill up, I do my best to advocate to say, can we add more? That's why we've got 2 Parkinson's support groups, because some people were having some trouble making the support group on a particular day. So we added, and then um, we have like a good, robust couple of support groups there. So it's really heartening to see that. So I'm glad. Anywho, were there any more questions that I missed in the chat, or?
No, but I love that
Okay.
Sherry shared this with us. It says Dr. Thakar has a helpful new podcast called The Caring Neurologist. I love
Oh,
that,
he
Sherry.
does. Yes, you're absolutely right. It's on YouTube. And the last time I looked, there were like 3, and but he's adding a lot more. I think altogether, he said there'll be about 24 of them. So yes,
Perfect. I
good
love it.
idea.
Technology meets information.
We also have what I will also do is share with you Belinda, the nurse navigator here, who's part of the team in our clinic, wrote a book, and it's all about some of the basic things that every Parkinson patient wants to know. And I can email that to Erin, and you can share that with everybody.
That is an awesome resource. I am so excited. I had no idea Belinda
Yeah.
wrote a book.
Yeah,
Yeah, that's
she did.
great.
Yeah. Yes.
How did I not
Yeah.
know that?
I don't
I will
know. Yeah.
happily share every resource she has. She's a wonderful part of our Parkinson's community. Thank you,
She
Joey.
is. Absolutely. Yes. Okay. Um, Now I forgot where I was. Oh, so some of the things that And I just made a list. I thought, what are the things that most people ask me about? So at any time, just raise your hand or shout out if you have a question about it, and I would be happy to go into it. People ask me a lot in alphabetical order, assisted living options, um, disability insurance from the state of California, options for caregivers, case management options, DMV plates. So whoever is moving here, Luis and Marcia, DMV plates probably would be a question that you guys would want to know about.
Yeah.
Right?
Yep. Yep.
Yeah. And something that comes up quite a bit in our Parkinson's support groups is disclosing that you have Parkinson's to the people in your life, to your work. Did you guys know that Parkinson's is a ADA protected diagnosis? And then there's also estate planning. People want to ask, they ask me about that, which is a very important thing, and I'll go into that a little later. Financial resources, also tied to that. Home modifications. Do I know people who can put in grab bars or a ramp or a variety of other home modifications? And what I always tack on there when people are wondering about their home environment is I think every insurance allows for you to have an order from your doctor that your doctor can say, I'd like my patient to have physical therapy come to the home and do a home safety evaluation. And they will come, physical therapy will look and see, do you need grab bars? Do you need support in this area? Do you need to get rid of some throw rugs or maybe add some brighter lighting to areas? Because we really want to make sure that people stay independent in their home and have that opportunity to do that. People ask me about meal delivery services, and that is kind of city to city. There are different options, so it depends on where you live. Medical equipment, is it covered by Medicare or insurance or not, and how do I get it? There's a bunch of senior centers. The senior centers are such a wonderful resource. In fact, where we are going to have our symposium is going to be at the Oasis Senior Center, which is in Corona del Mar. And questions about when to apply for Social Security, and do I need to hire an attorney to do that if I'm not 65 yet? Other modes of transportation that are different than the Orange County funded kind of transportation. And a big one that came up this past summer was traveling with Parkinson's. And how do I prepare for that? And what are some of the resources? And did you guys all know that you have the opportunity, if your doctor signs the letter, that you would have free and unlimited access to national parks without paying for it? And then this one is a really tough one, is what is palliative care? It gets a little confusing for people. And by people, I mean even your doctors, because a lot of times doctors will say the patient needs palliative care, and we have to talk a little bit more about exactly what that means. So those are the kind of questions that people ask me about quite a bit. One of the things that I touched on there is about the financial piece and what is financial navigation. We do not have financial navigators here in the Hoag Parkinson's program. We actually have them in our oncology program. But the Parkinson's Foundation, they recommend that you talk to a CPA or a financial planner. And I would add on to that talking to an insurance broker is also helpful in those kind of situations, because they're able to give you ideas about what kind of eligibility you might have for insurance, or What would your share of cost be? And then other options for financial assistance. Um, insurance is hard. It is really arduous, and they don't make it simple for people. And I kind of think they do that on purpose, just to try not to pay for things. So we do everything that we can to make sure that they're treating everybody fairly. We have a particular resource that is pretty cool in our area, and it is the Encompass Acute Rehab. I don't know if anybody's been there, if they're familiar with that. So acute rehab is an actual physical medicine hospital. So there are doctors and nurses there, and it's not a skilled nursing facility. It is short term, and by that, in Medicare world, that means less than 3 weeks, but it's often much less than that. And because of Encompass is the type of facility in California, to be able to go to acute rehab, you have to have been in the hospital for a certain amount of time. To go to Encompass, you can go directly from home to Encompass if you need to, because their headquarters are not in California, is what I've been told. And so the laws that apply to them are in their home state. And why that is really cool is we've had a couple people who have gone there and even have forgiven me for coming up with the idea. They tell me, because you stay there, you stay for about 10 days to 2 weeks, and you get physical, occupational, and speech therapy. There's a doctor there to oversee the physical recovery. And in a success story that I'm thinking of off the top of my head was somebody who kept having terrible falls, and it hit her head. She had Parkinson's, but she also had a concussion. And so, and she lived alone. So she needed to have an environment where it was safe. She stayed there. It's an actual hospital, just like any other acute hospital. And but they only do physical rehab. And she was able to get rid of her caregiver, remain at home, independent, driving, um, and and like I said, afterwards, she was like, I wasn't so sure about you on my first day, but by the time it was at the end, she goes, I had forgiven you for coming up with this idea. So to me, that was a big success story. But the reason why I brought that up in coordination with financial is that another person that we had tried to get to go there had been denied by their insurance. So um, we worked with overturning that denial, and as we speak right now, that person is in the Encompass Acute Rehab, getting some intensive therapy to try and get movement and balance back. So those are some of the things that we do from a financial standpoint. Um, and anybody have any questions? I feel like I'm just blabbing and not. Were there any things that you wanted me to elaborate on?
Yeah, Joy, if you don't mind, you mentioned the license plates. I didn't catch specifically what the comment was on that, the license plates.
So to be able to park in like the disabled parking,
Oh,
the
gotcha.
parking spaces that have the blue outline,
Yeah,
you need to have a placard or a license plate. And I always suggest getting the placard, because the license plate can get assigned to the person if it's the patient, their name has to be on the registration of the vehicle. But if with the placard, you can move it from one car to another. And if your partner's driving you and but you're the person with the disability, then you can still use the placard, so you can park close to the entrance and things like that.
gotcha. Okay, that's what I thought. I just
Okay.
want to make sure.
Yeah, yeah. Um, so another question that was a really good question is, what kind of care coordination and resource gathering does a medical social worker provide? So, um, when I worked in the hospital, it had a lot to do with the next step. And the next step was usually going home with a physical therapy at home, or going home and having like outpatient physical therapy, setting that up, or some of the people would go to acute rehab or even skilled nursing, just depended on what was appropriate. But in this environment, it's a little different. So the short kind of all-encompassing answer is I assess for psychosocial needs. So so that means the things that I can connect you to the right, like medical people. So you might have a question about what do I do? How my doctor says I need this. Who should I go see? And we can navigate that together and figure out with your insurance coverage what would be the right step to take. Psychological, we can assess for how the person is doing psychologically, and I'm also trained to be able to do assessments for memory and cognition. And social, I try my best. It's hard in this ever-changing environment to stay up on what is available for in the community and the social programs and resources that might be something that the patient could access. And financial needs, same caveat with that one. Things are changing daily, it seems like, on with financial issues. So we're trying really hard to make sure that we can stay aware of the different ways that we can help the patients financially. And then one thing that I did want to say here is you don't have to say, but I will tell you, I have an advance directive for healthcare because with working in the hospital for those 17, 18 years, I saw quite frequently how a person could go from being fine and able to tell you what they want and what their needs are to being unable to speak for themselves. And and it was often really important to make sure that we knew what the person wanted. Um, and so I'm a big advocate for putting it in writing. It's an important thing, and if you have a trust, it's often a part of your trust. But talking about it with people is important. I knew what my mom wanted. I know what my husband wants. We talk about those things so that we make sure that the person has their wishes honored. Um, let's see, care and coordination. Well, I try to keep everybody informed of resources. I heard actually yesterday, I don't know how many of you know that are in Hogue. We have just on the floor below me, where I am right now, it's a huge physical therapy department, and they're inundated. And if anybody is waiting for an appointment to get in to see a physical therapist or an occupational therapist, sometimes there's a wait for that. So to alleviate some of that, they are cutting back on what are called the aftercare resources. So um, up until yesterday, a person could go through our physical therapy program and kind of graduate, but still need to work out and keep up their movement and keep exercising. And so the aftercare program was a situation where they did boxing for Parkinson's. They did an exercise class. I don't know if it was just for Parkinson's or other people. Um, but it was run by their physical therapist down there, and they're needing the physical therapist to spend the time actually working with patients to address acute needs instead of the aftercare program. Um, so I've been putting together with Belinda a list of resources on a lot of it you might already know about because Parkinson's OC has most of it on there, or all of it maybe, I don't know, about the different exercise resources. So I'll be emailing that out to our patients. And some of the other things that we talk about are how to get legal aid. Sometimes people need help with finding an attorney. ADA rights is a big one for our patients. So I'm often advocating on behalf of the patients and asking a doctor to sign, could you sign this? Because I feel like that patient is not getting the accommodations or things that they need according to the adults. I'm sorry, the American with Disabilities Act. And I do a lot of disability applications so that people who have paid into the state and the federal system can access that money that they've been paying into all these years. And just in general, I try to help with the patients to navigate complex healthcare systems. It's hard. There's, it gets really complicated when your insurance, you need to have a benefit and maybe that they don't have that benefit, or you need to do like the a letter of agreement, which is if a certain program, or I'm sorry, a certain insurance carrier doesn't have that particular type of thing. I'm thinking of currently deep brain stimulation, where not all of the insurances, I don't know if they don't have somebody that can do it or if they're just not being really clear about it, but we're trying to help patients navigate that when that is something that seems like it would be helpful for them. And then, and often, and I don't mind this at all, I, I do communication and collaboration between patients, healthcare providers, other service providers, and families. We've had family meetings in here where, like, the caregiver is overwhelmed and they don't know how to say, I need some help. And and they have family members that maybe are willing to help, but haven't made that um, step yet to be able to help with all of the various things that need to happen. It reminds me of, like, what are some of the emotional or mental health supports that I can provide for people? Well, I do the support groups. I'm usually with a partner. It's either Belinda or another person. I run the support groups. Um, I teach painting with Parkinson's, which is, I think it's a mental health support. It's a definitely art therapy. It's also a social kind of prescription. And we used to go to the museum because I was finding that a lot of people were isolated, and getting out and doing something as a group was helpful. So I'm hopeful that we can start that again. I'm just waiting for interest in that. Um, I do family meetings, like I said, because it is not just the patient that is being impacted. Everybody is being impacted. Crisis intervention. We've had some situations where patients have, or others have escalated, and there was a need for some quick and serious interventions to keep everybody safe. I can also do contracts to mental health providers. So even though technically I am licensed as a psychotherapist, because of the amount of patients that we have here, which is well over 6,000 at this time, I can't do therapy with everybody. So that's why we do support groups. But I am definitely able to help you find a mental health provider if you wanted to do one-to-one therapy with somebody. And I do grief support as well. So we've had some situations where I think that in general that there are like two types of grief with our population, and I think that there is a prolonged grief that should not be overlooked, and it happens for everybody in the family. It's like this is not what we expected, and so learning to shift relationships and how we view ourselves is part of the grieving process. So we work with that, and you know, so those are some of the things. Let me see.
Joey, can I ask you a question?
Oh, for sure, yeah.
First off, where do you find the time? My question is, when people are first diagnosed with Parkinson's, are they referred to you? Do you get to talk to them? Because boy, could I have used a Joey when I was diagnosed.
We actually, did you see that little ghost go by? That was Belinda. Um, we did actually. So we've heard that in our support groups from more than one person, and that the initial delivery of the information was less than optimal. And so we made handouts, and that's part of what the book is used for. Belinda, her book is given to a new person. And then Belinda and I are here on site with most of the care providers. Obviously, like Dr. Sarami's in Huntington Beach, or Dr. Thakar might be in a different office that day. And I prefer that in that moment that we say, come get us. We'll come in, both of us at the same time. And just to let that person know that there is a whole team of resources and people, that you don't have to do this on your own. And we're here in small bites, or you can have the whole enchilada, however you want to do it. Everybody is different on how they process that. So yes, it's really important. And I know that Dr. Thakar has been really great. Like he and his physician assistants will give us the heads up and say, this person, I had to tell them today that, and then we'll call and say, here we are, we're in Newport, you're not alone, there are resources for you. And,
I'm
we're
so
gonna,
happy to hear that.
yeah,
So
I know
happy
it's shocking to me how often we've heard horror stories, because
well, it's so common still.
yeah, it's
We
too
have
bad.
great resources in Orange County. I mean, Hogue has great resources, but there's great resources throughout the county, all the
There
things
are,
the county offers. And, we've
yeah,
got over 20 support groups. And I mean, there's so many exercise classes, but people don't know about them and they're overwhelmed. And to just have someone like you with a little bit
mm-hmm,
of guidance is just, it's
yeah,
so needed. I wish every office, where people are getting diagnosed had
yeah,
or Belinda or someone to talk to them. It's so needed.
yeah. I think so, and I think that there's a lot of hope in, even though it's a difficult diagnosis, there's so much hope. And what we focus on is that you can thrive, you can travel, you can still do many, many things and live a meaningful and fulfilling life. So, and the first thing we say is get off Google. Don't go on Google. Don't start trying to figure
Yeah,
out
but we all go home and do it anyway.
I know, but it's such a horror story, It's not realistic, Y- Usually when people come to our Parkinson's support group, that's the thing that they tell us, is that I am so glad I came, because I saw all these people that are living good lives, and I never would have known that they even have Parkinson's, and it's possible. So
Joey,
yeah,
I,
yeah.
I have a question again, and I think you might have touched on it, but how do you access your services? Do you have to be a patient at home, and then that automatically connects to you, or could you just clarify that for me, please?
So the services where I'm running the support groups, you just have to tell me that you want to come.
Okay.
And then when we're there, a lot of times people will say, could you do you have any idea about this, or what about that? And I'm try to help from there. Um, and then the other way is, you know, a lot of the referrals come from our doctors. So, so technically you don't have to be a Hoag patient, but sometimes it helps to, you know, to get in to see us in the office. That can be better. Yeah.
Thank you.
Yeah.
My husband has an appointment in just about a half an hour, and we've got to
Oh,
get
gotta
in the
hop.
car. This has been so helpful, and I apologize, and I'm so sorry I can't finish this. Is this recording, Erin, going to be available?
Yep, the recording is available and will be available starting next Monday.
Sounds great. So
And
thank you.
Marcia, I
Yes.
got your email, so I'll email you.
Great. Thank you very
Okay.
much.
Okay.
Bye-bye.
Okay.
Perfect.
Yeah.
Joey, I actually want to follow up or have a question based on what Marcia had asked. What do people do if they're interested in finding a medical social worker to really help them navigate the complex system of just medical care in general? Maybe they've got a PPO and maybe they actually have several different doctors at several different areas, you know,
Mm-hmm.
throughout, not just Hoag or not just one medical center, but several. Like,
Yeah.
how do they access a medical social worker? Do they just go on Google and type medical social worker and hope for the best?
I tried that the other day. I was trying to find that for somebody. That's a really hard question. Because so let me back up. There are medical social workers that are part of the Hoag Medical Group. And because I've been in the Hoag bubble for almost 20 years now, it's hard for me to comment on what's going on in the other systems, which in our area, the big ones are Memorial Care and Providence, right? So I don't know exactly how you would do it if you were part of those. But within the Hoag system, there's they do have like a community team that kind of connects with the people who are part of Hoag Medical Group. So that means that that I don't think that you have to have Medicare necessarily. You could have like a Hoag Medical Group PPO or 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 the HMO or a Medicare Advantage. Um, other than that, there might be people who work privately, and I've been actually trying to find those people recently because I thought it would be really helpful for people who are not able to have access to us. But other than that, I don't know. I know that um, there are case managers. I know that there's through the Orange County Office Council on Aging, they have people who are nurse case managers, I believe, or have that type of experience. But as far as social worker go, medical social worker, I've only ever seen us in like a clinic or hospital setting. So,
So
but I'm going to keep looking.
So perhaps maybe the best advice is if somebody wants to access, say, a medical social worker that can help direct them within a community of resources, it's best to
Mm-hmm.
almost find what I would say almost like a closed community like Hoag. You can't speak for the other medical systems, obviously, but closed
Yeah.
systems probably have better senses of communities and how to navigate them rather than trying to piece part wherever you can. Is that correct
Yeah.
to say?
Yeah. Yes.
Okay.
And that's why I came up with those three kinds of social workers, the medical, the LCSW, or the county, because those would cover some of the needs that a person with a medical diagnosis might need.
That okay, got it. That makes sense. Just so
Mm-hmm.
I'm clear too, because a lot of people absolutely love what you do, and they want a million Joeys. But I have to be clear about where Joey exists,
Yeah.
and how to access a Joey.
Yeah. Like I said, I really actually was looking for something like that the other day, and I'm not able to find it easily. So I don't know what they're calling themselves or how they're presenting. So I'll keep looking.
Yeah, I do know that there's a social worker. I believe she's retired, Darlene Mann, who does a lot of work with some of the people up at Rogue. The thing is, and I don't think insurance covers her because she's
Yeah.
so, you know, she'll go out and she'll do, you know, a home evaluation for safety and things like that. And she'll help direct your
Yeah.
case management wise, but I think it's all private pay.
Yeah.
Correct.
Yeah.
Yeah.
And
And
luckily
many,
for me and for you guys, Hogue pays for me. So
Yeah.
my services don't cost you anything.
And I know
Yeah.
that Mission has, I don't know if they're social workers or case, they call case managers, but the only time I have interfaced with them is on hospital discharge, like for my in-laws
Yeah.
were, you know, crisis situation in the hospital and they needed to transfer to rehab center for a while. A case
Mhm.
manager would jump in and help. Depending on
Yeah.
who you got, you never knew how they were going to be.
Mhm.
They definitely weren't you, Joey.
Well,
But I don't know if they were social workers or not.
they're actually, some are nurses and some are social workers because I know the people down there. So it could be either or. Yeah.
now,
Yeah.
I want to be mindful of time. We do technically end at 1, and we're right over the hour. Are there any last questions that anybody has for Joey before we wrap up today's Ask an Expert session? Wow, Joey, I guess you're just that good.
Oh, wow.
I
I'm
think
so
Joey is,
sorry.
yeah, I just think Joey's one of those little nuggets of, you know, just such a resource center in herself that if you have a question, I always go to Joey. She knows so much about
Oh,
everything. And like she said before, you know, she doesn't have the answer. She can tell you where to get the answer. So
well, I try.
Yeah.
Yeah. I'm trying to send out okay. Okay. I'm trying to send a message to everybody with my email. So if you have questions, you can email me. And I'll take the emails that you have, Erin, and I'll send out that resource list of reminders of uh, the list I'm putting together for all of the folks who are currently doing our exercise classes here at Hogue that are going to be ending. So
Okay, perfect.
yeah.
And what I will
Yeah.
do is this recording will be listed on our weekly newsletter. Our weekly newsletter for Parkinson's Orange County goes out every Monday at 7 a.m. sharp. So look for it. And it'll also have Joey's information, including her email and the recording of the session, just so everybody has access to the info she just talked about. So, all
Yeah.
right.
All
Yeah,
right. Thanks,
Joe.
everybody.
Thank you so much.
Joey.
Thank you.
All right.
Yeah, we
Bye-bye.
are
Bye.
so lucky, Joey. Thank you for coming.
Such my
All right.
pleasure. All right.
All right. Bye,
Bye.
guys.